One of the things that patients ask me about is if they should be on one medication or multiple medications. And the answer is neither and both. So, in mild disease states, in mild depression, mild anxiety, medication or supplements might not be needed at all. Therapy and non pharmacologic interventions might be enough to get the patient through. However, in more severe disease states, in moderate or severe depression or anxiety, the patient might need a supplement or a medication to get them to the point where they're able to do the work of therapy. And it is work. So, if a medication or a supplement is needed, in general, in medicine, we want to avoid what I consider, what I've coined the term, white rabbit pharmacology. There's a song by Jefferson Airplane called White Rabbit, and it talks about Alice's adventures in Wonderland. And it goes, one pill makes you larger and one pill makes you small. I will spare you my singing, but it is basically what we're trying to avoid. We don't want to be chasing symptoms and side effects by just adding medication to medication. So what we want to do is, in the ideal circumstance, we want monotherapy or one medication that would take care of the patient's symptoms. For anxiety and depression, first-line medications are SSRIs, selective serotonin reuptake inhibitors, something like Zoloft or Prozac. And so, for example, if we use Zoloft, for example, minimum therapeutic dose of Zoloft is 50. It goes up to FDA-approved max dose of 200, though there are occasions where we go above that. And we want to dose optimize the patient. So we want to take that medication to a dose where the patient has symptom resolution or where they experience side effects. So say the patient is on 100, they've had some response to their anxiety and depression, but we try to take them to 150 and they have sexual side effects or GI effects that don't go away. So upset stomach, nausea, things like that. So in that case, if we don't have adequate symptom resolution, we can do something called augmenting, where you add a second medication because of tolerability concerns with the first. So for adjunctive treatment of depression, atypical antipsychotics, Vraylar and Caplyta, were recently approved for this use. So we could add one of those medications at a very low dose to the Zoloft and target symptom resolution that way without intolerable side effects. So in general, we want to use the minimum dose necessary of the minimum number of medications to achieve therapeutic effect and symptom relief.